Uric acid stone, renal stone, ureteric stone. What are the tips? How to take care of this kind of stone? I'm going to give you some evidence-based tips in this video. Renal stones and ureteric stones are stones that are found in your kidneys or in your urinary tract. These can be very painful. So if you have them, what kind of diet do you need to take? What kind of diet will help you to pass this stone fast? And what kind of things should you avoid? So first of all, the most important thing is that you need to increase your fluid intake. The more you will drink, the faster the stone will move from your kidney to your bladder and you will be able to pass it out. Now, if you're not passing out urine, then definitely go for a scan and get the diagnosis confirmed. But usually when the stone is less than 5 millimeters, it can be passed out with the help of medication and by drinking lots and lots of water. The amount of water that I'm talking about is at least 3 liters per day, and this has to be well tolerated. If you're not able to tolerate that much water, then definitely discuss with your doctor about the amount of water that you can take according to individual body needs. Now, when you're taking these fluids, make sure that you're also taking some electrolytes along with it, because when you're passing out a lot of fluids, you will lose your electrolytes. And if you don't replace those electrolytes, then there can be other side effects like muscle cramps, weakness, giddiness, and even fainting. So make sure that you're also taking some electrolyte powder along with it. You can even take oral rehydration solutions like the ones that are given to children when they have diarrhea or vomiting. Those can also be helpful. The next thing that you should take is pain medication. Now, if you're not having any allergy to pain medication, then you can take a simple painkiller like ibuprofen or paracetamol. And these will help you to reduce the pain and reduce the spasm in your kidney and in your ureter, which will help the stone to pass out faster. If the stone is large and not easy to pass, you have to consult with doctor to get treatment like some medications to dissolve the stone and to get some medical procedures like shockwave lithotripsy or ureteroscopy. Now, what kind of diet should you avoid? First of all, completely avoid dairy products. So this includes your milk, your curd, your cheese, and even your butter. All of these things have been proven to increase the risk of getting a kidney stone. Also avoid processed and packaged foods because they have high amounts of salt and sugar and preservatives, all of which will increase your risk of getting a kidney stone. And last, complications. You need to be aware of the complications of kidney stones. If the stones are not treated properly, they can cause complications like acute kidney failure, chronic kidney disease, infection in the kidney, which is called pyelonephritis. And in rare cases, you can even lose your kidney if the stones are not treated. I hope these tips will help you to understand how you should take care of your renal and ureteric stones. If you like my content, please do share it with your friends and families so that they too can take care of themselves. For more such informative videos, don't forget to follow.